Hi, my name is Robert Shelley with Chelle Law, and I'm an attorney that assists physician assistants with employment contract and independent contractor agreement issues. Today I'm going to talk about physician assistant productivity bonuses. So what are some ways that they can be structured, and then some kind of red flag areas to think about and make certain the language in your contract is protecting you. So what is a productivity bonus? It will be tied to either RVUs if you're working in a hospital environment. If you're in private practice with a physician, it will likely be collections based. Some primary care clinics will have an encounter based bonus, meaning the expectation is to see 30 patients a day, and then any patient above that, either weekly, quarterly, monthly, whatever they want to do, you would get a set dollar amount above that. So let's take kind of the three different models, and I'll go through what to expect and then how to make certain that you aren't giving up any money. So first would be RVUs. This is really only used in a healthcare or health network or hospital environment. If you're in like a smaller physician-owned practice, they generally do not use RVUs. So how a bonus would work is you would have some kind of threshold. So maybe you have a straight, base salary, and then they would say, all right, you're expected to make or generate 1,000 RVUs per quarter, and then any RVUs generated above 1,000, you would just multiply the RVUs times some kind of compensation factor, and then that's the bonus that you would receive, usually within the first pay period after the end of the quarter. So that's simple, is you understand kind of what numbers you have to hit, and anything above that, you would get paid that amount. Now, the threshold is important. You want to do a little bit of research in advance of signing any contract to make certain that the bonus that they're offering you is reasonable and potentially gettable. Sometimes I'll see contracts where the RVU kind of expectation is well beyond either what they're being paid as a base salary or what's normal for that position. And in that scenario, sometimes we have to do some negotiation about lowering the threshold or perhaps also upping the compensation factor as well. Next, let's talk about collections-based productivity bonuses. So if you're working in a private practice in a physician-owned practice, as I said before, collections percentage is a normal way of doing productivity. And so in that scenario, they're expecting, let's just say quarterly, maybe they expect you to collect X amount of dollars, and then you would get 20% of any of the dollars over the threshold. So I'll just give an example. So let's say you're expected to collect $30,000 a month based upon your personally performed services, and then if you collected $35,000 in that month, they would just multiply that times 20%, and then that would be the bonus that you would get on a monthly basis. One big red flag area that you want to make certain is correct in your contract is if you are on some kind of collections-based productivity model, you want language that says you will get any earned bonuses. Sometimes, especially if it's like an annual bonus, it will say you have to be employed at the time the bonus is given out. And many times they won't put any language about when they pay it out. So you want to make certain that there's language that says they'll pay it within 30 days of the end of the month or quarter or year, and that if you've earned the bonus, you will receive it regardless of whether you're employed at the time. And so why is this important? Well, if you decide to leave the practice and you give notice, and there's no kind of limit on how long they can hold your funds. I've had clients who have earned a bonus, but there's no language about when it's paid out. They give notice and the employer just drags their feet, never pays out the bonus, the contract terminates, and then they move on and don't get the money that they earned. So make certain it says how quickly you'll be paid and that you will get paid if you have earned a bonus. So lastly, encounters. This is, I would say, rare, but I have seen it and this is almost always in primary care, where the clinic will say, the expectation is you'll see 30 patients a day. And so I don't think they would do it weekly, but probably monthly, sometimes quarterly. And so take that, whatever the amount. So if it's, 30 a day and they were going to calculate it monthly, they just multiply 30 times however many days you worked. And then any patient seen above that amount, you would get, $20 or $30, just as an example. That's a fairly easy way of doing it. I mean, volume though is, unless you're very slow, a lot of times you're not specifically in charge of your schedule. They just fill up your schedule and you work. Maybe you're at a clinic where there's a ton of no-shows, which certainly happens, or the MAs or RNs or whoever's doing the rooming and H&Ps are just very slow and inefficient. So you could miss out on bonuses just because the practice isn't run properly. So prior to starting any job, you need to make certain, all right, what is the average encounter amount for the other PAs in the practice? Are you efficient? Ask all the questions, because if you have a bonus that's impossible to hit, then it's worthless. You want to, and then, kind of your morale goes down, your kind of, fire to hit these bonuses goes away, and they're kind of worthless. So anyway, that's a little bit about productivity bonuses for physician assistants. If you have any questions about an employment contract or independent contractor agreement, feel free to contact my law firm at the information listed below in the description. And I appreciate you watching the video. All right, thanks. Take care.